All right, Marty, thank you very much. Time right now is 8:04.
It sure is, and it's time for this week's edition of Happier at Home. And this morning, we're discussing colon cancer and the potential risk factors in the elderly.
Yeah, for more, we're joined now in the studio by Deb Marcello from Happier at Home. Deb, thanks for being here.
Thank you.
The statistics surrounding colon cancer are pretty startling, especially with new reports that have just been released.
Yes, it actually is being diagnosed at a younger age. People are getting cancer, colorectal cancer at a younger age, especially men. It is the leading cause of death for those 50 and older of cancers. So starting screenings earlier is a really important thing. Knowing your risk factors, looking out for signs and symptoms of cancer as well are important, but really the most common symptom is no symptom at all.
That's scary.
It is. So I don't think everyone's aware of the new guidelines that there should be screening at an earlier age, starting at 45, and that's if you don't even have a family history of colorectal cancer.
Yeah, if you do have that family history, they, what is it, 40 for if you do have a family history of it?
Well, it really depends on when that person in your family was diagnosed.
Okay.
So if they were diagnosed really early, they may want you to come in 10 years prior to the age of diagnosis for your family member. So really working closely with your specialist, the GI specialist,
People
to
find
know that.
the whole process of the diagnosis, though, scary, just going in to get tested, but it does not need to be scary.
Right, it doesn't, because a lot of the testing you can do in your home. Just work with your doctor. There are 3 types of testing that you could actually do in your home. It's stool samples, testing for blood in your stool, microscopic blood, and certainly if you see frank red blood in your stool, then you should see your doctor. There's DNA testing now, which can be done in your home, and the sample sent out, which is every 3 years. And there's also testing that will help to determine if there's early tissue growth as well. It's called a FIT test. And so these are samples that you could take in your home and send out to the lab to be tested.
Now, lifestyle choices play a big role in colon cancer. Yeah, diet,
Right.
smoking, exercise, that type of thing.
Yeah, it's actually what they're thinking is one of the more common reasons that people are being diagnosed with colorectal cancer at an earlier age. I mean, alarmingly so. It was those at a younger age at 11%, and it's almost doubled at about 20% now. So even though this is more common as you're getting older, it's very highly treatable, highly detectable if you're doing these testings, and then also having a colonoscopy. That is probably the most specific test where you're able to go in. Right now the recommendation is starting at 45, every 10 years, but if you have polyps with your first one, or like we said, if there's a history of colorectal cancer, they may want you to start that sooner and maybe have it more frequently. And it really is not a bad test. You are sedated for it. So it's just something that is highly treatable, like I said, but having that awareness of these testings and screenings is not enough. You need to act on it. So making sure that you're staying in close communication with your providers and proactively looking for this testing.
Is there a cutoff age? You do it 45, 55, 65, at 75. Do you need to continue to be tested?
Well, they say they usually stop at age 75. If the life expectancy is expected to be over 85, then they probably would continue on.
Okay.
So it is, I think that's what they're looking at. What's the cost versus benefit, and you know, there's even ways for those that are elderly, if they can't go through a colonoscopy for medical reasons, to do a CT, a colonogram, so they don't have to have that same sedation and the same procedure done too.
And the happier you are, or the healthier you are, the happier you are at home.
Absolutely, you are.
Hit them with the socials. Where can they go to learn more?
You could go to happieratHome.com. and we'll have this blog up online.
Awesome.
Yeah.
Thanks, Deb. We appreciate it.
Thank you.